viewers.
I am Tina Maramiti Cervantes.
And I am Kim Cyril Roque.
We are here to discuss the poisonous substances treated in Jose Reyes Memorial Medical Center.
The gathered information were just limited because of the restrictions to access the patient's medical records. What are poisons? Poisons are substances that cause disturbances to organisms, usually by chemical reaction or other activity on the molecular scale. When sufficient quantity is absorbed by an organism, the field of medicine and zoology often distinguish a poison from a toxin and from a venom. Toxins are poisons produced by some biological function in nature, and venoms are usually defined as toxins that are injected by a bite or sting to cause their effect, while other poisons are generally defined as substances absorbed through epithelial lining such as the skin or gut.
This graph illustrates the common poisonous substances treated at Jose Reyes Memorial Medical Center. There are 6 poisons, namely alcohol intoxication, which is ethanol-containing beverages such as liquors, then benzodiazepine drugs such as diazepam, heavy metals, specifically mercury, arsenic and lead, iron poisoning, carbon monoxide in cigarettes, and organophosphates such as insecticides, and others like medication overdosage. As being shown on the graph, ethanol intoxication is the most common poison that is treated in Jose Reyes Memorial Medical Center. It means that many patients were being poisoned due to drunkenness or excessive intake of alcohol. Next to alcohol intoxication is carbon monoxide poisoning, which is commonly happened through cigarette smoking. Benzodiazepine drugs got 16.03%, which tells that many people are still taking these drugs for drug addiction and not for medication-related problems. The fourth is organophosphate poisoning, which got 8.33%, because of inhalation of insecticides, which is used in the house for garden purposes. Fifth one is iron poisoning. However, it got 6.25%. It happens because of iron overdosage due to taking of medicines. And lastly, arsenic, mercury, and lead got 5.16%, which got the lowest among of the 6 poisons. The common victims of these poisons are children because these substances are sometimes contained in toys. Now, let's go over with the poisons one by one. First is alcohol intoxication. Alcohol intoxication, also known as drunkenness or inebriation, is a physiological state that occurs when a person has a high level of ethanol in his or her blood. Common symptoms of alcohol intoxication include slurred speech, euphoria, impaired balance, loss of muscle coordination or ataxia, flushed face, vomiting, reddened eyes, reduced inhibition, and erratic behavior. In severe cases, it can cause coma or death.
The signs and symptoms of alcohol intoxication include confusion, vomiting, seizures, pale, cold, clammy skin, dangerous anger, seizure, and slow breathing. The management of alcohol intoxication includes protect the vital signs by monitoring the ACT or airway, breathing, and circulation. Protect the airway from aspirating the stomach contents that could cause aspiration pneumonia. Treat the hypoglycemia with a low blood sugar with 50 ml of 50% of dextrose solution. Administer the vitamin thiamine to prevent Wernicke-Korsakoff syndrome that may cause seizures, and apply hemodialysis if the blood concentration is dangerously high.
The second poison is carbon monoxide. Carbon monoxide is known as a silent killer because it is colorless and odorless, and thus virtually impossible for a human to detect. The symptoms of carbon monoxide exposure are typically seemingly harmless, which is why detection of carbon monoxide poisoning often comes too late. Cigarette smoking is highly addictive and dangerous habit. Unfortunately, although many smokers know that smoking can lead to lung cancer or lung diseases, few are aware of the dangers of carbon monoxide. Carbon monoxide is present in every cigarette, causing a legitimate threat to a person's health. Anyone who smokes, regardless of how often, should know about carbon monoxide and how it affects the body when it is inhaled. In the body of a smoker, carbon monoxide blocks the absorption of oxygen into the bloodstream from the lungs. This process has the effect of poisoning the red blood cells in a way that prevents them from carrying oxygen. When body tissues do not receive a constant and adequate supply of oxygen, these cease to function. In the same way that a car's tailpipe releases carbon monoxide, so does a light of cigarette when someone smokes it. Studies have indicated that a carbon monoxide molecule more closely resembles hemoglobin than an oxygen molecule. This means that the carbon monoxide found in cigarettes replaces oxygen in the blood. When this happens, it becomes difficult for the red blood cells to do their job and carry oxygen throughout the body. Research has shown that a person who smokes a pack of cigarettes in an 8-hour time period will see their carbon monoxide blood saturation rise to between 7 and 15%, thus reducing the availability of oxygen to the body. This seems especially dangerous when you consider that the normal rate of carbon monoxide in the blood is between 0 and 8 parts per million.
Symptoms of mild carbon monoxide poisoning include lightheadedness, confusion, headache, vertigo, and flu-like effects. Larger exposures can lead to significant toxicity of the central nervous system and the heart. Initial treatment for carbon monoxide poisoning is to immediately remove the person from the exposure without endangering further people. Those who are unconscious may require CPR on site. Administering oxygen via non-breather mask, it shortens the half-life of carbon monoxide to 80% from 320% on normal air. Oxygen hastens the dissociation of carbon monoxide from carboxyhemoglobin, thus turning it back into hemoglobin. Due to the possible severe effects in the fetus, pregnant women and treated with oxygen for longer periods of time than non-pregnant people.
The third poison is benzodiazepine drugs, specifically diazepam with a brand name of Valium. Diazepam is also marketed in Australia as Antenex. It is commonly used for treating anxiety, insomnia, seizures including status epilepticus, muscle spasms such as in cases of tetanus, restless legs syndrome, alcohol withdrawal, benzodiazepine withdrawal, and Meniere's disease. It may also be used before certain medical procedures, such as endoscopies, to reduce tension and anxiety, and in some surgical procedures to induce insomnia. It possesses anxiolytic, anticonvulsant, hypnotic, sedative, skeletal muscle relaxant, and amnestic properties. The pharmacological action of diazepam enhances the effect of the neurotransmitter GABA by binding to the benzodiazepine site on the GABA receptor via the constituent chlorine atom, leading to the central nervous system depression.
The antidote of choice for benzodiazepine poison is clomazepine, with the brand name of Romazicol. The adverse effects that may be felt by the patient is dizziness, agitation, dry mouth, tremors, palpitation, insomnia, dyspnea, hyperventilation, labiality, confusion, convulsions, cutaneous vasodilation, nausea, vomiting, abnormal vision, headache, pain at the site of injection, and increased sweating.
The fourth poison is organophosphate poisoning. An example of this is parathion and malathion. This results from the exposure to organophosphates, which cause the inhibition of acetylcholinesterase, leading to the accumulation of acetylcholine in the body. Organophosphate poisoning most commonly results from exposures to insecticides or nerve agents. Organophosphates are one of the most common causes of poisoning worldwide and are frequently intentionally used in suicides in agrarian areas. There are around 1 million organophosphate poisonings per year, with several 100,000 resulting in fatalities.
Choice for organophosphate poisoning is atopy. The patient may experience these kinds of adverse effects such as fever, delirium, hallucination, dyspnea, tachycardia, dryness of the mucous membranes in the mouth, and flash and dry skin.
The fifth poison is iron poisoning. Iron poisoning is an iron overload caused by a large excess of iron intake and usually refers to an acute overload rather than a gradual one. The term has been primarily associated with young children who consume large quantities of iron supplement pills, which resemble sweets and are widely used, including by pregnant women.
The antidote of choice for iron poisoning is deferoxamine with the brand name of Desferal. Upon treatment, the patient may experience hypotension, rash, generalized erythema, allergic hyperactions, and pain at the site of injection.
The sixth and last poison is the heavy metals such as arsenic, mercury, and lead. Heavy metals sources of toxicity can include environmental, water supply, industrial, hobbies, and others. Thus, a full history of a person's work and living habits can help pinpoint potential heavy metals.
The antidote of choice for arsenic, lead, and mercury intoxication is DMSA with a brand name of Chemet. The patient treated with Chemet may experience nausea, vomiting, diarrhea, loss of appetite, metallic taste in the mouth, elevated serum transmerases, and these poisons will bring this time. Always remember to take care of your health and modify your lifestyle if you have a bad virus and unhealthy living. Take care of yourself and have a good day.